So this is about the conjunctiva and the lacrimal apparatus, so the stuff that basically produces tears. So we'll talk about the conjunctiva first. Some diseases can occur because of trauma, like foreign bodies, lacerations. Of course, if there's a laceration, you only need to suture the eyelid if there's a third eye. If the third eyelid is torn, but actually we don't usually suture, we might just leave it if the conjunctiva is cut, and we will usually suture with catgut sutures because they're absorbable. Trauma also usually leads to subconjunctival hemorrhage, as you can see, just some bleeding, and you treat basically the cause. So if the object is still in the eye, remove it. Let's say this is the object. And what else? Yes, use antibiotics, of course, because it's dirty, and cold compresses just to reduce the inflammation there, because inflammation doesn't help. We'll use this picture for conjunctivitis too. So it's usually caused by infections with a number of things, but not just like bacteria. Some people will forget chemicals and allergies, like dermatitis can lead to this. We mentioned it briefly. We can guess the clinical signs of conjunctivitis because inflammation leads to like redness, swelling, pain. You can imagine, but a lot of people with conjunctivitis always forget that discharge can occur too. And there are actually different types of conjunctivitis. So let me find something. Yeah, so this is the hemorrhage I mentioned with conjunctivitis that can occur. Whoopsie daisy. Sorry. So many conjunctivitis pictures. Okay, yes. Okay, so there are different types of conjunctivitis. So we'll start here, for example. So there's Cathal conjunctivitis. So Cathal conjunctivitis is when you get a mucousy discharge and purulent discharge, mucopurulent discharge. So it's like a yellow-green pus. You can guess this is because of infection. Now with viral conjunctivitis, what happens is it's a viral cause. So in dogs, for example, will be canine distemper. With cats, it could be feline herpes. And again, you get a mucopurulent discharge. There's also keratoconjunctivitis, which we'll talk about plenty. So yeah, they're just showing other examples of diseases. I'm just going to skip loads. Anyway, so keratoconjunctivitis. So this is not just inflammation of the conjunctiva, but also the cornea. So this looks really bad. And the reason it looks bad is maybe the eye isn't so damaged itself, but also it results in very dry eyes. The way you test this is using the Schirmer tear test. It should show less than 12 millimeters per minute on the little strip you use. There are also cat lipogranulomas. So these usually occur in cats. So what are these? These are little nodular lesions in the eye which lead to conjunctivitis, and you treat it basically it's kind of gross. You use like a curette, you scrape it to curette the lesions. Now move on to diseases of the lacrimal apparatus. There we go, different color, different theme. Okay, so we've dacryoadenitis. So this is where the lacrimal glands are inflamed. This leads to not only inflammation, as you can see, there's like swelling, but the eye is very dry, and we know this because of the green discharge. We can see this dog has had fluorescein, but green discharge, not like highlighter green like this, but like, you can even see it. You can see that with dry eyes, and you treat it with antibiotics basically. There's also imperforate puncture. I just want to show a picture because, it's harder to visualize. So imperforate puncture, what it is the tear duct opening hasn't even developed. So you can see how dry the eyes, and this is the green discharge I mentioned. So it's not always with infection. Sometimes the eye is just so dry, it doesn't produce tears. It produces just green gunk, basically, because tears aren't just fluids. The meibomian gland actually produces these lipids. So I think that's the reason why. And basically, it can be congenital or it can be acquired, like in the case of feline herpes. I mention it a lot, but it's a very good example. How do we diagnose this? It's quite ironic, actually. Even though the tear duct opening hasn't developed, we get epiphora, which are excessive tears. And what you can do as well is you can put a cannula in the puncture to actually... to diagnose it. You can see that the tear duct opening isn't developed, and you can treat it by basically removing the overlying conjunctiva, like so, with scissors, and basically suture the area after you've cut it open. But also, before you've done that, you can embed a catheter towards the medial canthus with pressurized fluid, just to open up the tear duct, and that should be fine. There's also another disease called dacryocystitis. Yeah, so this is just what I mentioned. You cut it open, you embed a cannula. Dacryocystitis, okay. This is where the lacrimal sac and the nasolacrimal duct is inflamed. Yeah, you can see it. And what you get is mucopurulent discharge. But what's interesting is you also get bubbles in this case, so I don't know if you can see them very well. And you treat this with antibiotics, and with an antibiotic corticosteroid combination, and the main one they mentioned was polymyxin B, which is the antibiotic, and dexamethasone. Next disease is, I just want to get the right one for you guys. Okay, because I can't read it. All right, I think it's this, cyanoblepharon. So this is basically adhesions between the conjunctiva, so the conjunctiva kind of like fused together. So what you get is, of course, conjunctivitis. It can be a consequence of dermatitis as well, and it can lead to cicatricial nasolacrimal obstruction. So, okay, what does this mean in layman's terms? An infection has led to obstruction of the stuff that causes tears. So what you get is puncture or nasolacrimal ducts that are scarred or blocked. So you can see like there's been some blockage of the tears here. So there's like an inflammation, a swelling. So how do you treat it? Basically, you excise again. You can use a cannula where the punctum should be, or where the conjunctiva flares up if you're not 100% sure. And when it's flush, you will add glucocorticoids to prevent the healing, because of course if the area heals, then the puncture will block up and you can't produce tears.